I want to start with some important facts and figures about DAYBUE now that the therapy has been on the market for a little over a year. As a reminder, DAYBUE was approved for the treatment of Rett syndrome for adults and pediatric patients that are 2 years of age and older. So no limitations on gender, male or female, no real limitations on age except you have to be 2 years of age and older. So it's a fairly broad indication. We're thrilled that over 1,300 patients so far have come forward to start treatment with DAYBUE just in the past year. That represents 1 in every 4 diagnosed Rett patients in the United States. There are prescriptions that have been written for DAYBUE spanning a broad range of ages and disease severities. You can see that we have a number of prescriptions for children as young as 2 to 4 years of age, and a significant number of prescriptions for individuals who are 5 to 10, 11 to 15, 16 to 20, and over 28% of our prescriptions are coming from patients who are over the age of 21. So we have a number of older patients that have initiated DAYBUE treatment over the past year as well. And that's been a question that's come up often is, can DAYBUE be used in somebody who's older than the age of 20? And I think this data is a very clear yes for that. We have over 650 physicians across the United States who've written a prescription for at least 1 Rett patient over the past year. When they've written their prescription, what have we seen? And we're going to get into some of the treatment benefits and improvements in a moment. And then finally, on the upper right, we share information about patients who are starting and staying on DAYBUE therapy out to at least 6 months after they initially started treatment. And you can see that approximately 7 out of every 10 patients who start treatment with DAYBUE continue on to treatment after about 6 months.
I'm Art Beisang. I'm what they call a complex care pediatrician up in Gillette Children's Hospital in St. Paul, Minnesota. And I'm co-director of our Rett syndrome clinic, and I've been managing Rett syndrome for 20 years.
And what's been your experience with DAYBUE in the past year? Give us a sense of how many patients you prescribed DAYBUE for and the types of patients.
My oldest patient is 60. So
60.
I've got
60.
60, yeah. So I've got a wide variety of patients. We have about 50 patients on DAYBUE right now. And just like Rett syndrome, the experience is different for everybody because Rett syndrome is different for everybody. But in general, it's very positive and very exciting.
Okay, well, let's jump into some more of your experiences. But first, let's set up, what do we know about DAYBUE? What do we know about the data? What do we know about the clinical trials that have occurred with DAYBUE? And talk a little bit about what we've learned before we get into some of the lessons learned over the past year in the market. And I'll have Dr. Beisang walk through some of the early development studies.
This shows how you get a drug to market, basically. We start with phase 2 and then move to phase 3, which is a bigger efficacy trial. And then at phase 3, we had approval. But we pretty much started with the lavender trial in this phase, which was, I think we had about 180 patients divided between control and patients actually on trofinetide or DAYBUE. And then after 12 weeks, they were able to switch over, and everybody was able to use the DAYBUE and measure efficacy. And then once approved, it went to the LOTUS trials. Which
yeah, Dr. Subbiah, tell us about the LOTUS study.
Yeah, so the LOTUS study is actually a real-world study. And why is that important? Because we do these clinical trials to get the drug approved, but the research doesn't stop there. Because we know that once the drug gets approved, it's used in a much broader population. And so we really wanted to understand what is happening with real-world use. And so that is what the LOTUS study is. And this study is still ongoing.
The data that we have with DAYBUE has been achieved in really the largest set of clinical trials ever conducted in Rett. We have hundreds of patients that have been in the clinical trials, and as I mentioned before, over 1,300 patients that have initiated therapy in the post-marketing setting. Now, let's get into the data. Dr. Beisang, talk us through what we learned from the phase 3 study, the study that got us approved.
Lavender, which was that first 12-week study with control versus people on the active medication, we did really 2 measures. We had the RSBQ, which all of the parents rated improvement, and then we had the CGI-I, which was how the doctors rated the improvement for patients. And even after 12 weeks, we saw enough difference between the active medication and the control group to be very encouraging.
This was the 12-week study, but we know that Rett is a lifelong disease requiring chronic treatment. Walk us through this next slide, which has a lot of figures, but I think has an important message to take home.
It's busy, it's got a lot of graphs, but it really looks at that first lavender data for RSBQ and to Lilac 1 and to Lilac 2. And with the RSBQ study that the parents did, they rate how severe their Rett syndrome is. And the higher the number, the more severe it is. So we actually like lower numbers. And so you can see people that started at lavender 1 and moved all the way through, it continues to decrease, which means we continue to have improvement over this long period of time of 52 weeks. And that's what I see in clinic.
So what do you see out to 2 years? Are you seeing a consistent set of improvements? Are you seeing new improvements starting to occur over the course of time?
We continue to see improvement. This is Rett syndrome. It's different for everybody. So that's my disclaimer every time I say anything. But yeah, we generally see improvement over time.
Ponni, if you can walk through some additional research that we did, essentially asking caregivers, what did you observe in those clinical trials? What was your experience? What was your perspective?
Yeah. So one of the things we wanted to really understand, we have these formal scales like Dr. Beisang just reviewed. But what we did at the end of 2 years in the study of the third graph called Lilac 2, we really wanted to understand from caregivers in their own words, what did they see? What kind of improvements did they see? And so what we did was we interviewed the caregivers whose children completed the study. We asked them, like, what were areas of improvement? And I want to first draw your attention to the right. And you'll see that all of the caregivers reported at least one area of improvement. But what's really important, as Dr. Beisang said, we know that patients with Rett present with various types of symptoms. And so what's important is 92% reported areas of improvement, at least 3 areas, and 58% in over 5 areas. So what were these types of improvement? You will see improvements included engagement with others, improvement in hand use, eye gaze. Some caregivers reported improvement in use of their Tobii eye tracker device, ability to make sounds, among others. So this was a very important study, and this is why the input from caregivers is so critical, because you are able to see the everyday changes, and that's what we tried to capture here.
So we are going to shift gears, and we're going to talk a bit more about side effects and the tolerability of DAYBUE. We know that a lot of you have questions about both the benefits that we've just gone through, but also about the side effects of DAYBUE, and you want to learn more. And we know that diarrhea is a concern, right? This comes up often, we get asked often. And what I want to do is just kind of set up, well, what have we observed in the past year, right? We've learned a lot through the clinical trial experience, but I think we're learning a lot more about what it's going to take to be successful, to not just start DAYBUE, but to stay on DAYBUE for the long term. So let me first start with some of the key insights and lessons learned. And first is diarrhea prevention and management strategies, they're being used inconsistently. And you can see some of those in the brochure. You see some of them that were part of our approval a little over a year ago. And we see that many families who start DAYBUE oftentimes are struggling with understanding what are effective mitigation strategies. What are effective methods to prepare for and manage diarrhea, especially early in the first days and weeks and months after starting therapy. Things like, when do I stop by anti-constipation medications if your loved one is constipated? Things like, when do I start taking more fiber? What changes should I make to my diet? What about the use of Imodium to manage diarrhea along the way? These are all effective mitigation strategies, but the most important part is having a plan and understanding the tools that are available at your disposal and following really close guidance from your care team and from your physician as well. Dosing. In the clinical trials, there were very specific doses that were used for DAYBUE, and DAYBUE has been approved with 5 different dosing levels based on the weight of your loved one. What we're seeing in the post-marketing setting and the post-approval setting is titration is being used by doctors, And again, these are all important strategies, but the important point here is having the clinical judgment and the expertise of clinicians like Dr. Beisang to help guide the conversation. I mentioned before that there are over 650 prescribers for DAYBUE since the approval. That's a great thing, but we know that Rett is a very complex disorder. There are not 650 Rett experts in the country, I don't think, Dr. Beisang, and I think part of that has led to different sets of treatment experiences, different levels of engagement between a physician and a family, especially early in therapy, and I think that's led to differences in the overall treatment experience and overall outcomes as well. And then the final point I'll make here before I turn it over to the conversation is there is a path to successful management of diarrhea, successful management of tolerability, and a successful overall treatment experience. And we're seeing that, right? We have 7 out of 10 families who start DAYBUE are staying on therapy out to 6 months and beyond. But the important part here is finding the right balance in terms of having a diarrhea management and side effect management plan, working very closely with clinicians, and being armed with the facts, being armed with understanding what it looks like, what improvements look like, and what having a proactive GI management plan in place looks like.
I think that the big things I like to really emphasize are we have a lot of flexibility in where we start. With DAYBUE, we are so lucky that we can just stop it on a dime and restart it as we need to. When we start a family on DAYBUE in my clinic, we plan a 2-week follow-up, either virtually or by messaging through our medical record.
So you have a very close coordinated plan with families. You meet with them early, every in the beginning, at week 2, maybe at week 4 again?
Yeah, and so we start with a plan, but just like Rett syndrome, it changes frequently, and we have to be flexible.
Yeah.
But having a good relationship with somebody who's going to talk that through with you, so when you're making decisions that work for your family. It's important.
Well, and talk to us a little bit about what does planning look like? Talk to us about how you think about setting the right dose for families, and some of these tips to plan ahead before starting DAYBUE to ensure, again, that when you start, you're starting successfully and you're giving your loved one the best chance at staying on therapy for the long term.
Sure. So most of my patients are on several medicines for constipation. When we start DAYBUE, we usually stop a lot of the laxatives, the Miralax, the Senna.
So again, this information is also in the brochure, but as I mentioned at the beginning, right, consistent understanding and implementation of these GI management strategies, these may look simple, but they're not implemented as consistently as we think they should be. And I think, again, understanding what they are, being armed with information from the beginning, and working closely with your prescriber, we think is just so important, and maintaining that close connectivity, especially in the first 2 to 4 weeks, is important as well. I want to move on to Lotus and Ponni. Again, benefit of Lotus is it's real life, right? The Lotus study was designed with getting feedback from caregivers in mind, both on treatment benefits, but also on their GI tolerability experience. Ponni, walk us through what we learned and some of the key insights there.
And this is really based on input from the caregivers who we worked with when we were first designing the study. And the caregivers told us, it's not just diarrhea, there's different types of diarrhea. And so the lightest green represents loose but not watery stool, and it's contained within the diaper. The next level of green is it's watery stool, but it's contained within the diaper. And as you get further, it's patients who experience diarrhea. It was watery, but it was outside the diaper and out on the clothes. And then the darkest green is if it was watery, but outside the diaper and outside the clothes. And the caregivers told us this is really important because then if it's outside on the clothes, outside the diaper, it's going to be more burdensome, not only for the patient, for the family. It affects if you're able to do social things. And so we really try to capture that in this study. So now let me walk you through the data. So you will see that at various stages, if you just look at the green, you will see the diarrhea can vary from about 20% to about in the 40s, depending on the weeks. But you'll see at majority of it is in the lighter green, which means even when there was diarrhea, it was contained within the diaper. But I want to also point out that in this real-world study, there were a lot of patients who also had formed abnormal stools. That varied from about 42% at week 1 to about 63% who had normal stools
That's
at
the
month
purple?
6.
That's the
Purple.
That's the purple.
In month 6. And you'll see the constipation, which we know is one of the most common, symptoms of Rett. It is present early on, but then it decreases in frequency. But there are still some patients that have it, and that's why, as Dr. Beisang said, your partnership with your healthcare provider is critical because there's an art to this, and that more the partnership and the communication, it helps with the outcomes.
Can you walk us through, how will my physician determine the right dose for a loved one?
Yeah, so this is the suggested dosing for the FDA, and this is kind of my goal dose for everybody. That's really an individual decision between you and whoever's prescribing it for you.
Yeah. And Ponni, anything you want to share from Lotus?
I think one of the, and this was mentioned previously, is when we got caregiver input in the real-world study, one of the things that we observed was there was an inconsistent use of the different types of tools out there to help manage the diarrhea, and including, for example, stopping the laxatives early enough. Fiber was a very critical part. A lot of the clinicians have told us that has really helped their patients. So again, I think the brochures will help kind of educate, but that's, I think, something to think about, that there are tools out there to help manage, at the same time, hopefully observe the benefits with the drug.
Perfect. Well, thank you, Dr. Beisang. Thank you, Dr. Subbiah. I actually want to take the opportunity now to invite our 3 caregiver speakers up to the stage here with me, please. So while they're walking up, let me introduce Allison, Amy, and Heidi. We're going to talk about their personal experiences with DAYBUE. Claire, Maddie, and Ellie, who are their daughters, are all enrolled in Acadia Connect, which is our patient support program. And they're also receiving other types of therapies, physical therapy, occupational therapy, all those sorts of things. And the goal for this conversation is for each of them to introduce themselves and their families, and then we'll get into questions around the types of benefits that they're seeing and their experiences with DAYBUE over the past couple of years. So welcome to all of you, and thank you so much for your time. So we'll start with some brief introductions. We'll start first with Heidi.
Hi, everybody. My name's Heidi Greenall, and my daughter Ellie is 15. We also have a son, Reese, who is 10, and we live in Fort Collins, Colorado, so we are very local.
Perfect. Thank you. Thanks, Heidi.
Hi, I'm Allison. I live with my husband, Brendan, in New Jersey, and our older daughter, Anya, and Claire Bear, who is 8. And Claire is not here, so we even get a little vacation.
Last but certainly not least.
Hi, I'm Amy. We live in Colorado Springs, and so not too far for us either. And we have Maddie. She's around here somewhere. You'll see her. Say hi to her. She loves attention. We have a daughter named Anna, who's 18, going off to college, and we have a son named Luke, who is 11. And we have a dog named Chase, who is in some of the photographs.
Fantastic. So we're going to get into a conversation here, and we'll start first with Heidi. And the first question is, each of your loved ones have now been on DAYBUE for a couple of years, but go back to that time before they were on DAYBUE. Talk to us about your decision to even try DAYBUE, and I'll start first with you, Heidi.
I think for us, I had friends that were in the first trial, and I knew there had been success with that. And so when I knew that we had a chance to be on it, I jumped on it instantly. And I think I was just so excited to see what could happen. We were one of the first here to be in the trial, so we've been on it like about 3.5 years now. And so at the start, we had no idea what to expect. We didn't know how to manage diarrhea if we got it. We didn't know about the gas and all that. So I think we had to navigate a bit different than, the people starting now. But I was just so excited to see what could happen. We had no idea, and we were just, I was hoping we'd see better hand movement, maybe a word here or there. I think for us, it was something we couldn't pass up.
How about you? What was your perspective?
Well, like Heidi, my daughter has been at it since the very first phase of trial, and we did not know. We didn't know what improvements to look for. We knew nothing, but I would say mainly our word was just hope, and we wanted to do our part in the Rett community, and if it helped, great. If it didn't, we tried.
Yeah,
And so we were just excited to be a part of it.
So Claire was diagnosed in 2020. It was a busy time in the world. And shortly after, we started seeing our clinic. And our doctor really said, this can really help her. You should give it a try. And I think it was an easier decision for us because you guys had all gone first. Like, she was getting into the end of the lavender study. And there had been a lot of information out there on people who had already been in the studies and tried it. And so we said, this could help her. If it doesn't, we'll stop. And if it did, which it did, we were very happy to continue. But at that point, it was an easier decision for us because there was information out there. If you get poop, what do you do? If this happens, what do you do? And so, yeah, we were really excited to get into the trial. And so Claire's been on it since 2021 now, so almost 3 years.
And she's 8 currently. So talk to us a little bit about, you have a daughter who's 8, yours, Ellie's 15 going on 16.
15 and a half.
15 and a half,
Yeah.
and then 20. Talk to us about your experiences on the younger end of the spectrum.
Yeah.
Decision to try, but also what did you see in the beginning?
Yeah, it's very hard to say, like, a lot changes in a kid between 5 and 8, and Claire grew up a lot. She put on like 8 pounds, she grew. And so she's been making leaps and bounds with a lot of, I guess you would say more, what's the word, like basic motor skills. She wasn't always watching the exact same TV show all the time. She started to like branch out. We've seen a lot of improvements because she's at that critical stage in her life where she's just growing so much. The medicine is helping that. It's like adding to it.
Mm-hmm. And what about your experience? Your daughter's 20.
She's 20. She'll be 21 in August. And so we were different. And Maddie's, before the drug, we weren't having any improvements. And Maddie was pretty miserable all the time. A lot of crying, a lot of everything you're probably experiencing now. And then.
And how old was she when she started?
She was, we started the trial in 2017. So maybe
13, 14 years old? Yep.
Yes, and sorry. Too early for math. The math's not mathing. And then, we were in all the different phases, so we would stop medication and the improvements would dissipate. But we've been on drug almost 3 years now, and it's been awesome.
Okay, that's great.
We were content with where we were, but I'm really glad we took the chance.
Fantastic.
Yeah.
Thank you for sharing that. And Heidi, but what about you? Tell us a little bit about Ellie's early experiences, what you started to see in the beginning, and then I'm going to transition to kind of longer term, what you've seen. But talk to us about the beginning and the early days.
Sure. So I think with Ellie, I'll start by saying Ellie is ambulatory, but she never spoke. She never had any words. She did have use of her right hand, not like we have use of her right hand, but she could pick things up with her right hand. But no, she couldn't use her left hand at all. And she lost that during the regression. She also had a late regression, and Ellie also wasn't diagnosed till she was 7. So I guess for us, the first thing we noticed was just this awareness. It was almost like she couldn't see, and then she put glasses on and she could see everything. Her emotions were just on point. She was much more engaged with us. She would laugh, belly laugh at things where we hadn't seen that since pre-regression, And her hand use got a lot better. She now carries things again. She used to carry things when she was little all the time. She always had something in each hand. And also for Ellie, she's gotten some words. And like I said, she'd had a pop-out word here or there. She babbled a ton, but she never actually spoke. And now she says, well, when she first started, she started going, fuh, and we're like, uh-oh, what's that going to be? Because she's 15, right? So, but it was fun. So now she says fun and funny, and she said food. And for some reason, she has F words. I'm not sure why. My husband is British, so it could be that. But if you watch Yo Gabba Gabba, which she loves, there's a character named Fufa, and she has a fufa on her bed, and one night she looked at it, and she all of a sudden said fufa. And so now she says fufa every night. So and for us too, so we've been on it, a long time now. It's just part of our life. Okay, I'm not gonna cry. I do cry sometimes, so I apologize, but I won't. But it's continuing to change. We're not seeing anything stop. And every time I talk to you guys, I'm like, oh my God, guess what she did now? So it's one thing after the next. And, you know, we have phases where we kind of aren't seeing something, and then all of a sudden she'll do something else. So, and sometimes not so great, you know, we still have the waves. And my husband and I were talking about this, and it's almost like, and again, it's different for everybody, but we're seeing things that she lost in regression coming, you know, starting to come back. And it's a lot of work, it's a lot of therapy. We're constantly, you know, that never ends. So, yeah, I mean, for us, it's been real successful, and we're still seeing changes, and we have no plans to stop taking it.
And she's been on for how long now?
She started December 2019, so we did the first part of the trial, and then COVID hit. COVID hit the day, or the hospital shut down the Friday before we were supposed to start the real drug. And I was like, oh, are you kidding me? So then we had to wait till December to start again. So we started December 2020.
Allison, how about you? What was your experience, not just in the beginning, but over time? Give us a sense of what that looked like for you. And also, who's seeing the benefits? Because I know as caregivers, you guys are seeing things day to day, but what about other members of your family, relatives, teachers? You know, are they picking up signs of benefits as well?
Oh, yeah. It's beneficial to everybody. Like we always say, Claire actually being on DAYBUE made us more of a tight family unit. We used to have to divide and conquer a lot. Claire didn't want to sit at Anya's game, or she didn't want to go here. We couldn't take her places. And now we can actually do things as a family more. She's calmer. She's not as agitated about things. I will preface this by saying Claire has been on it for 3 years, but she only takes half a dose. She had some side effects, and we have never gotten past a half dose. She never had any words. She babbles a lot, but she's making better strides with her iPad device. She's babbling, I want to say, like, more purposefully. Like, there's not a word, but, like, she'll be sitting there with her music box on and be like, blah, 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 blah. Mm-hmm. She's made a lot of improvements in OT with her fine motor skills. Her tell with her hand is she, like, grabs her elbow, and she's kind of all knotted up like a pretzel. And since we've been on DAYBUE, it's a lot. Her hands are very fluid. She actually has her hands down a lot, like not moving. They'll just be sitting on her lap, not moving. So if I hold out an ice cream cone or a pencil to her, she'll grab it, and she was never able to do it. She carries things across the kitchen. Sometimes we find her juice box in like random places now. So it's been like beneficial for everyone. She's not self-sufficient. We all know that, but like she's more self-sufficient than she was. She's able to go to the fridge and point to what she wants, and then she goes and sits on the couch and watches her show. And so it's just a little easier on us not having to be on top of her all the time.
Yeah. And you mentioned side effects. I want to talk to the two of you as well, because that's an important question, right? We talked a lot about the treatment benefits and what your loved ones have observed, but you also talked about side effects. What's been your experience, and what's been helpful to you in navigating through tolerability?
Yeah, so we did not get diarrhea. Claire's big side effect was she had a behavioral side effect. She got very, very angry, agitated, biting herself, hitting her head into the wall, like really angry. And as parents, you know your kid. And we were on the open label for about a week, and we go to CHOP, and we called him up, and we said, this is not right. Like, something's wrong. This is not our kid. And we ended up titrating down to a half dose, and it went away. And she was fine. And we tried a couple of times in the trial to go up, and it just wasn't working. So we stayed at the half dose. Since it's been on the open label, or since DAYBUE was approved, we've gone up 1 milliliter at a time. We talked with our doctor about this, and we have a very, very, very slow titration process. We go up like 1 milliliter every couple of months, but it's working. We got up from 15 to 20 in the last year, and she didn't have any side effects with it. So this like really slow going process that us and our doctor just came up with actually works for her.
Yeah, and it speaks
and we're
to
not seeing side effects.
Speaks to what we talked about with Dr. Beisang, right? The close coordination with your team was helpful in helping you navigate through that. And how about you, Amy? What's been your experience?
Well, Maddie is not ambulatory, and I just, I get so, I get the feels when you girls talk about your girls walking. Maddie is not. She is able to stand a little bit with some help, but not much, and she is not vocal. Her hand use is a lot more fluid. She can relax them a little, but she still rings pretty hard. But as far as side effects, she spit up quite a bit, and so she always had reflux even before, so she spit up, but we managed that with our team. And Maddie's been on full dose the entire time. Okay. And so for Maddie, that's 50 mLs twice a day. She does have a G and a J, and she also has an ostomy bag. So but we just give it in her G, slow. And Maddie's done really, really well with this, and we can, anytime, I know we're going to run out of time here because we like to talk about our girls, but ask us anything. And but Maddie's big improvement is Maddie, I always call them blue spells, and her apnea. She was having over 100 spells a day, and those are significantly less. And that was our huge improvement, as well as alertness. And she likes NBA games now. And you would, guys, you know how it is. You would never take your girl into a stimulation like that. And she likes really tall NBA players. And she likes to track them. It's so, just so you know, it's confidence. Our family has improved confidence. And so we can deal with spitting up because we're happier as a family and really confident.
That's great. Well, I know we're coming closer to the end, but I do want to ask really an important question for all of you, which is the question that's on the slide, right? We talked about your decision to try DAYBUE, and I think we have a lot of interested families here in the audience, some of who may be thinking about whether DAYBUE is right for them. Some of you may already be on DAYBUE or your loved ones. Some of you may be off DAYBUE at this point. What's your individual message to those that are seeking more information, that want to figure out whether DAYBUE is right for them? And to help overcome maybe some of the questions that are out there in the community. So maybe Heidi, you want to kick us off?
Sure.
Yep.
For me, what I always tell people is if you don't try, you'll never know. And I think for us, we have a great team here, and our doctor was by our side the whole time. So I think if you don't try, you'll never know. It may work, it may not, but I think it's worth the risk. It's been great for us and all of us. So just find us, and we'll be happy to share our tips and tricks and things we've done to make it work for us throughout the trial and throughout the last couple of years we've been on it and on trial. So yeah.
Thank you. Please.
Oh, well, I believe you said earlier about rocking the boat. It's it's kind of worth it. Just rock it a little, see what happens. Talk with your team, get a good plan. If it's right for you, go for it. Think about it if you need to. Ask a lot of questions. There are a lot of positives out there. You're just probably not hearing them as much. But there are side effects, or true side effects. So you need a plan. But I don't know. My thing is just have some hope, rock the boat a little, and see what happens. Because our life was pretty stable before this, but it's much improved.
I think, can I add one more thing really quick? I think starting and stopping is okay too. I have a good friend who happens to be in this room, and the first time they did it, it was awful, and they had a lot of side effects, and then she said, we're going to try again, and they've tried again, and it's been successful. So I think it just depends, and I think, that's fine to do, and like Dr. Beisang said, you can stop at any time. We actually stopped at one point when Ellie had really bad gas for about a week, and it was fine. So I think, just go for it. If you want to, talk to your doctor. That's the most important. Also, make sure you have a really good team backing you up and someone that you can rely on and call. And I know you talk to your patients a lot. So I think that's really important as well.
Yeah, we've seen a number of families that have restarted over the past year. And again, it's because when you stop, you lose your benefits as well. And I think, again, understanding the path to getting to a dose and getting to a plan that works for you is important. Allison, how about you?
I would just say to think about, obviously your child's health is the most important, but also think about everyone that interacts with your child. We were struggling a lot with her sister. Her sister had a lot of anger towards us. We were always with Claire. We always had to take care of Claire. Why isn't mom hanging out with me? So not only is Claire doing well, but we're all doing better. And, I get it, the people who have severe diarrhea, and it does not make your life better. It's making it harder. But you don't know that until you try. And there's a lot more information out there about avoiding the diarrhea. So if that is your one thing that's stopping you, don't let that stop you.
Well, and Dr. Beisang, anything you want to add just in terms of your guidance to families as they seek information?
The things I was going to add, they already said. I think, we can start and stop. There is a lot of ways to start and a lot of ways to stay on it.
Yeah, and I think kind of just to wrap up, I think that we have learned a lot in the last year, and I think you're learning about some of the lived experiences from our 3 caregivers. Dr. Beisang is giving you his perspective in treating over 50 patients at Gillette in the past year, and we've learned a lot as well. And I think that the point that I'll underscore is you get the facts, right? We want you to understand what's available to you, understand the benefits, understand the risks, how to overcome some of the tolerability challenges. And our job is to arm you with that information. So you have some of that here. So I want to thank all of you for joining the breakfast program this morning. I'll thank Dr. Beisang, our 3 caregiver speakers. Thank you so much, and Dr. Subbiah. We appreciate you taking the time. We appreciate being a part of this community with you, and thanks so much.
What are the possible side effects of DAYBUE? Diarrhea. Diarrhea is a common side effect of DAYBUE that can sometimes be severe. Diarrhea may cause you to lose too much water from your body, dehydration. Before starting treatment with DAYBUE, stop taking laxatives. Tell your healthcare provider if you have diarrhea while taking DAYBUE. Your healthcare provider may ask you to increase the amount you drink or take antidiarrheal medicine as needed. Vomiting. Vomiting is a common side effect of DAYBUE. Sometimes vomit can get into your lungs, aspiration, which could cause an infection, aspiration pneumonia. Tell your healthcare provider if you have severe vomiting or if vomiting happens often. Weight loss. DAYBUE can cause weight loss. Tell your healthcare provider if you notice you are losing weight at any time during treatment with DAYBUE. The most common side effects of DAYBUE were diarrhea and vomiting. Other side effects include fever, seizure, anxiety, decreased appetite, tiredness, and the common cold. These are not all the possible side effects of DAYBUE. Tell your healthcare provider if you have any side effects that bother you or do not go away. What should I tell my healthcare provider before taking DAYBUE? Before taking DAYBUE, tell your healthcare provider about all of your medical conditions, including if you have kidney problems, are pregnant or plan to become pregnant. It is not known if DAYBUE will harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if DAYBUE passes into your breast milk. Talk to your healthcare provider about the best way to feed your baby while taking DAYBUE. Tell your healthcare provider about all of the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Taking DAYBUE with certain medicines may affect how the other medicines work and can cause serious side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You can also call Acadia Pharmaceuticals Inc. at 1-844-4ACADIA, 1-844-422-2342. What is DAYBUE? DAYBUE is a prescription medicine used to treat Rett syndrome in adults and children 2 years of age and older. It is not known if DAYBUE is safe and effective in children under 2 years of age. DAYBUE is available as an oral solution, 200 milligrams per milliliter. The risk information provided here is not comprehensive. To learn more, talk with your healthcare provider and read the accompanying patient information. Visit daybue.com for the full prescribing information.